name is Elizabeth Lockwood, and I'm from CBM. And I'm just going to provide some technical points before we start today. This event will be recorded, so please take note of that and shared later on the World Data Forum website and International Disability Alliance website. International sign interpretation is being provided and is spotlighted, as well as live captioning, which you can find by clicking on the closed caption box on the bottom of your screen or using the link that is being posted in the chat box. Presenters and moderator will use their cameras while presenting, but then turn them off. And please note, we don't have any visuals or PowerPoint presentations for our event. Throughout the event, please ask questions by posting in the chat box, and we will get back to you by the end of the event. And if we don't, we will post an email where you can follow up and we will come back to you. We will also be sharing relevant links throughout the event in the chat box, so keep a lookout for those. Now I'm inviting our moderator, Facundo Chavez Penillas, Human Rights and Disability Advisor from OHCHR, to begin the meeting. Over to you, Facundo. Thank you.
Thank you, Elizabeth, and thank you, everybody, for attending to this meeting. I would like to welcome you all to this event on persons with disabilities and COVID-19, data collection and disaggregation efforts. As you have heard pretty much in every single webinar that you have attended, the situation that COVID-19 had brought to our world at this moment, it's really pretty much enhancing the shortcomings that in many, many areas of policy implementation our countries have been facing for many years, and in particular with regard to persons with disabilities, this had not been the exception. And with regard to data collection, what we have seen is that we have an enormous gap when it comes to persons with disabilities. We have seen shortcomings on data collection in different contexts, in particular in areas such as institutions where persons with disabilities and older persons with disabilities have been perhaps more impacted than others. And this, despite the fact that we have data collection tools that are available, and that the areas to collect data on are clearly identified and prioritized. There are not with regard to this particular aspect, there had been some efforts in data collection that had been related to either research or community-driven data to complement policy, and this had come as perhaps a little bit as a lifeguard in this particular case. So today we will discuss how to move forward, what are the practices that are particularly contributing to the efforts that are coming from the states. And without further ado, I would like to give the floor first to Neda Jafar, who's the head of statistical policies and coordination unit in UNESCO. Neda, you have the floor.
Thank you very much, Chair. Greetings to all from Lebanon. I will highlight the importance of statisticians and policymakers working together to create evidence-based policymaking by sharing the newly released ESCWA Disability, SDG, CRPD, and Human Rights Framework. Ladies and gentlemen, disaggregation by vulnerable subpopulations, including persons with disabilities, was only given the due importance in the 2030 Agenda. Disaggregating data is not a new subject. Countries have been disaggregating their data by common characteristics such as age, sex, location, and some even cross-classifying them with socioeconomic characteristics, such as employment and education. However, lack of disability-related data is one of the major barriers to the accurate assessment of disability equality and inclusion in the development and humanitarian contexts. There is also no existing policy data integration monitoring tool for persons with disabilities based on CRPD, the Universal Declaration of Human Rights, and the SDGs. So the Economic and Social Commission for Western Asia, ESCWA, developed with the collaboration of statisticians, policymakers, regional and international organizations for persons with disabilities, a three-dimensional framework that maps articles of CRPD with the Universal Declaration of Human Rights and interlinking them with the goals of the 2030 Agenda. That aims to empower people with disabilities and monitor progress through 115 measurable indicators. Now, the objective of the ESCWA disability framework is threefold. First, to provide data producers with a common tool and language to guide the production and dissemination of quality and comparable data, and to develop a generic tool to support national statistical systems in engaging with their policy counterparts and identifying and prioritizing statistical information needs and data gaps. It will also support and inspire policymakers, civil society, and academia to collaborate in designing more inclusive, responsive, effective, and evidence-based policies and facilitate monitoring of progress towards these goals. What is important is that the framework indicators can be collected from household surveys through the use of the Washington Group questions in order to identify people with disabilities in comparison to those with no disabilities in a harmonized and comparable manner. The ESCWA Disability, SDG, CRPD, and Human Rights Framework lends itself to localization and adaptation at national, regional, and global levels, and can be complemented by big data. Nonetheless, it is worth noting that out of the 115 framework indicators, the Arab region is able to produce only 52 indicators that are harmonized and comparable, which is less than 50% of the framework indicators. This information indicates that the region's capacity is at this baseline that needs to be monitored, and the progress toward increasing these indicators should be done in the coming years. It highlights the importance of exerting more efforts in strategizing to improve data collection tools. We also know that countries' efforts since the adoption of CRPD to enact and address global rights, laws, and policies that affect persons with disabilities reveals that while progress through the convention and global social movements has occurred, nations still have a long way to go in fulfilling their commitments. Only a quarter of countries in the world have constitutions that specifically prohibit discrimination or guarantee equal rights on the basis of disability. In conclusion, only if the implementation and monitoring of the SDGs are in line with the CRPD and the Universal Declaration of Human Rights will the goals be achieved. The collection of disaggregated data by disability and production of harmonized comparable indicators is key to ensure that the request and commitment to leave no one behind is fulfilled, especially after COVID-19 pandemic and the high socioeconomic impact of this crisis on vulnerable groups. The framework provides a starting point to bridge the gap between policymakers, people with disabilities, and statisticians. Thank you.
Thank you, Neda, and thank you for reminding us the importance of producing harmonized indicators is key to ensure that we leave no one behind. And we look forward to see how countries will be using UNESCO's disability framework in their implementation and to bridging that specific gap that already exists in country policy implementation. I would like to now give the floor to Jose Vieira. Jose is the Chief Executive Officer of the World Blind Union and permanent representative a stakeholder group of persons with disabilities. Jose, you have your turn.
Thank you, Mr. Chair. Good morning, good afternoon, good evening, everyone. It is my pleasure to be present in this distinguished event, and I am very happy, particularly to officially launch the very first comprehensive disability data advocacy toolkit. This toolkit that I am presenting today, and I hope you will all find it useful and start using it very soon, is the result of what I think has been one of the most increasing demands among people with disabilities and their representative organizations. And that is how to better engage around data collection and how data can be used for better advocacy and policy changes. This toolkit is also the example of a long-term collaboration between the International Disability Alliance and the International Disability and Development Consortium, two big partners of people with disabilities and their representative organizations. I would just like to highlight a little bit of a background on how we sort of came to where we are at in terms of this toolkit. In 2019, under the umbrella of the Stakeholder Group of Persons with Disabilities, we established the first global disability data advocacy working group. And that platform had the intention of getting together organizations of people with disabilities, organizations that are working in the field of disabilities, to develop and to promote dialogue among all these interlocutors and how we can better understand and use data for people with disabilities. And this toolkit actually has the overall goal to actually contribute to that growing discussion around how data can be used and actually how people with disabilities and their representative organizations can interact with governments, international agencies, etc., and fostering the idea of more data around people with disabilities. Of course, this toolkit is a practical set of elements that aims at promoting that discussion. And among different aspects that this toolkit tried to cover, I would like to highlight at least two, which I think are the most important for us to know in this webinar. One is the need for data. I think there is an increasing demand for people to understand why we need data around people with disabilities. And that's why we first in this toolkit try to address that gap, why we need data. And this toolkit tries to respond around that questions with elements like we need data to better understand the reality and the current situation of people with disabilities. And of course, when we talk about COVID-19, is one of the most best example on how much this need of data for people with disability is required around the world. Also, we need data to support statisticians, governments, but also organizations of people with disabilities in advocating for their rights and meaningful participation. A second aspect that I would like to highlight from this toolkit is that after we recognize the need for data, the big question is how we use, analyze, and trust the data that we collect. And again, this toolkit aims at responding some of the questions, how people with disabilities and their representative organizations can actually support some of the official data that is collected, and how people with disabilities and their representative organizations are actually developing a lot of good examples in community-driven data, and how that data can actually be used by governments and statisticians. I think, as a conclusion, people with disabilities and their representative organizations are, with this toolkit, more equipped to better interact and engage in global, national, and subnational discussions around data collection. Therefore, there is no excuse to not include people with disabilities and their representative organizations in these discussions. I always like to conclude this type of presentation by saying that people with disabilities and our representative organizations are the one who knows best what affects people with disabilities. We have to learn about statisticians, we have to learn about other good practices, how to collect data, but we are the one who knows what matters to people with disabilities. With these toolkits, we aimed at creating that bridge that connects people with disabilities, representative organizations, statisticians, and everybody else involved in this discussion. I would just like to thank all the people involved in development of this toolkit, CBM Global, International Disability Alliance, stakeholder group of persons with disabilities, and we really look forward to continuing the discussion, and we hope that this toolkit can be used and you can all find it useful. Thank you, Mr. Chair.
Gracias, Jose. Thank you, Jose. It's been very, very useful to hear from this tool and to bring that perspective, right? That persons with disabilities should be at the center of the exercise of exposing what are the issues that concern them, that affect them, and also that can be agents of change, right? That they can contribute to the larger community, including the statisticians community, to provide data on what are the issues that are affecting them effectively on a day-to-day basis. Thank you for that. Then I would like now to give the floor to Miriam Gasser, who's from the head advocacy of CBM Switzerland. Miriam, you have the floor.
Thank you very much, Facundo. Hello, everyone. I will talk today on disaggregated data and why it is critical for inclusive emergency response. On May 20th, the super cyclone Amphan passed through Bangladesh, leaving behind devastation in a coastal southwest region of the country. Preliminary findings indicated over 2 million people have been affected. CBM, in partnership with the Center for Disability in Development, the Disabled Rehabilitation and Research Association, as well as ADD International, conducted a rapid needs assessment in the districts of Satkhira, Patuakhali, and Bagarat from May 23rd to 25th this year by conducting interviews with 161 of the most at-risk individuals in the affected regions. Furthermore, we also did key informant interviews. The purpose was to assess how well persons with disabilities and other at-risk groups were included in preparedness measures, and also generate initial data regarding impact and identify unmet needs to inform inclusive response programming. Interviews were conducted by phone to the COVID-19 situation, and then the findings were entered into an online survey form. The interviews were conducted in proxy in cases where the respondent was not able to answer the questions directly. The rapid needs assessment included the use of the Washington Group short set of questions to identify persons with disabilities. Actually, 40% of respondents reported having a lot of difficulty or cannot do at all in at least one of the 6 functional domains of the 6. What were other findings? Food security and livelihood remained a top priority among those interviewed, with over 3/4 of respondents stating that they had less than one week's supply of food or cash to actually purchase food. Also, over half reported that their livelihoods had been lost due to the cyclone, and opportunities to earn a living was very limited due to the COVID-19 restrictions. Findings also highlight that there needs to be a multi-sectoral inclusive approach, targeting those who are at the highest risk. For example, barriers remain with some early warning systems and evacuations measures that are still inaccessible for underrepresented and invisible groups, such as deaf and hard of hearing persons, as well as persons with intellectual disabilities. Positively, findings also indicate that preparedness efforts have been made more inclusive, and that such as the engagement of organizations of persons with disabilities in disaster management committees, as well as awareness raising in the community. What are the recommendations coming out? We need to involve persons with disabilities and their representative organizations in planning, implementation and monitoring of response and recovery efforts, and to ensure that this is in line with the CRPD as well as the SDGs. We need to collect and disaggregate data by age, gender, and disability to learn about barriers and to measure disability inclusive response and recovery actions. But of course, this is not enough. We also need to analyze and to remove barriers that prevent persons with disabilities and other at-risk groups from accessing humanitarian assistance. And importantly, we need to put in place specific measures to ensure persons with disabilities access to humanitarian assistance on an equal basis with others. So this is actually a very good example of a quantitative study that was complemented by citizen-generated data using the Washington Group short set of questions, which is an internationally comparable tool. The important findings from this study highlight why decision makers should not only consider official statistics, but also community-driven data to fill the missing gaps and to reach those furthest behind. Thank you.
Thank you, Miriam. Thank you for providing that example. I think it was very, very useful to see how using existing tools for measurement, like group short set of questions, plus quantitative analysis, plus a human rights perspective on how to see participation of persons with disabilities is living out part of the policy development and implementation processes in the aftermath of a disaster in particular can really contribute to advance the agenda and how to bridge those gaps in those particular areas. So thank you very much for that intervention. I will now give the floor to Anderson Gitonga, Chief Executive Officer of the United Disabled Persons of Kenya. Anderson, you have the floor.
Thank you very much, Mr. Chair, and greetings from Kenya. I am going to discuss our process of getting the Washington Group short set of short module into our national census conducted in 2019 and highlight how organizations of persons with disabilities are involved, and also share our experiences in regard to COVID-19 data processes in Kenya. The Kenya Population and Housing Census in our country was carried out in 2019. The sector for a period identified a gap in terms of generation and management of official data. where data collected has not adequately informed the design of policies and programs. To use the Washington Group module is something that the disability movement in Kenya has advocated for, with the hope that it would ensure the availability of high quality, inclusive, timely, and reliable data. We have desired to see a situation where disability-related interventions are informed by data. Initially, there was intense training of officers from the Kenya National Bureau of Statistics on the importance of using the Washington Group module to collect data. Secondly, and importantly, was the involvement of organizations of persons with disabilities in the process. Through the United Disabled Persons of Kenya, persons with disabilities went through trainings on disability data, including the use of Washington Group module. The International Disability Alliance, through its Bridge CRPD SDGs training, continued to strengthen the capacities of leaders in the disability sector on advocacy for appropriate disability data. These empowerment processes led to use of Washington Group module in the 2019 census. From the census statistics, what has been published so far include distribution of the population aged 5 years and above by disability status, as well as distribution by type of disability. A disability monograph shall be published that shall look on various indicators such as access to education and employment, among others. Through a framework of continuous engagement with organizations of persons with disabilities, stakeholders, and the Kenya National Bureau of Statistics, organizations of persons with disabilities are now members of a technical working group on disability statistics, which going forward will be the consultative framework on disability data in Kenya. Currently, we are engaged in discussions around having a disability survey as guided by the disability movement, specifically to collect data on the situation of persons with disabilities. Allow me to share what we see as the next steps in regard to COVID-19 and disability statistics. There are various efforts from partners in Kenya on ensuring that there is good data on disability. Looking at COVID-19, for example, we noted challenges when it came to disaggregation of data. Whereas as an umbrella DPO, our first agenda in the initial months of the pandemic was to ensure that persons with disabilities were part of the response system, that we were meaningfully engaged in the various intervention processes. We noted huge gaps in the area of data disaggregation. Rapid surveys that were carried out to determine the socioeconomic impacts of COVID-19 on households did not disaggregate this data by disability status. We still did not have data on how persons with disabilities accessed hospitals, or for example, how accessible isolation centers were, among other crucial aspects as regards the response on COVID-19. In the lack of this data, we have used research and community-driven data to complement official data for policy making and decision making. We have relied on data from DPOs as well as from commissioned studies. For example, we rely on DPOs at the federal or county level to see if persons with disabilities are aware and are part of COVID-19 response committees, or for example, how many are receiving cash in the Inclusion Works project led by Say Savers International to collect data around the experiences of persons with disabilities in Kenya during the pandemic. Such studies revealed that over 92% of persons with disability interviewed on the impact of COVID-19 said their daily lives had been affected. Pinpointing factors such as limited transport, restricted movement, lack of necessities, lack of contact with others at school, religious and social functions, reduced income, and loss of jobs or income. Many had employment, a job insecurity, and were concerned about their finances. Finally, we have continued to work with other partners to ensure that we address these gaps in data collection. In July 2018, for example, at the Global Disability Summit, the government of Kenya signed up to the Inclusive Data Charter. The Inclusive Data Charter is a unique multi-stakeholder initiative working to advance inclusive data globally. Together with the Global Partnership for Sustainable Development Data, who leads the Inclusive Data Charter, the organizations of persons with disabilities are part of the group helping the ministry, the focal point Ministry on Disability, to develop its Inclusive Data Charter Action Plan, which aims at strengthening the disability data and working very closely with the Kenya National Bureau of Statistics. Thank you very much for listening to me.
Thank you, Anderson. It was very good to hear you. It's been very complete. The number of areas of engagement that organizations of persons with disabilities in Kenya are moving at this point. I think it's so important to refresh from the more structural areas that are connected to censuses and the inclusion of the identification questions of the Washington group in censuses, but later going down into surveys and community-driven data collection can be all complementary tools that can move things forward. Thank you also for bringing all these examples that are connected to real gaps that already exist, as you mentioned, on attention of persons with disabilities in hospitals and so on, which is so important to measure the actual impact of policies and measures that have been implemented so far to combat the pandemic. I would like now to give the floor to Jennifer Marens, who's the acting director of the National Center for Health Statistics. And a pleasure to have you with us. Jennifer, you have the floor.
Thank you so much, Chair, and thank you to the organizers for inviting the Washington Group to present at this event. I'd like to talk a little bit more about the use of the Washington Group tools in the COVID-19 response, and we'll be kind of referring back to some of the previous presenters. So it's been mentioned that these tools exist, particularly for disaggregation, but I'd just like to mention that since its inception in 2002, that was the year the Washington Group was started, the group has developed a whole suite of data collection tools along with materials to support the use of these tools by not only national statistical offices, which was really the first objective, but also NGOs, OPDs, international organizations, and a whole host of other data collection entities. The tools have been widely adopted so that consistent, comparable information to monitor compliance with the UNCRPD and the SDGs is becoming increasingly available. And we hope that the tools can also be used to increase our knowledge about how COVID-19 has affected persons with disabilities. I think it has been very clearly pointed out that the pandemic has provided additional and very strong evidence of the need for data disaggregation to determine whether the rights of persons with disabilities are being protected during this pandemic. Equitable access for people with disabilities to not only testing for COVID, but also to all of the medical, social, and economic resources that have been put in place as a result of the pandemic must be part of all COVID-19 planning and programs. And I think it's been well established that they really do need some data in order to appropriately develop and to monitor these programs. The way that the Washington tools can be used to monitor the impact of COVID-19 is exactly the same way as they are used to monitor the SDGs or the requirements of UNCRPD or their use in refugee and humanitarian responses, as has been discussed. The question sets can be added to any data collection system, including surveys, administrative systems, or program intake systems with no modification and with minimal additional cost and burden. They were actually designed to be added to other surveys. And so any data collection that's being used to monitor the pandemic, whether it's an existing data collection that's just been modified to monitor the pandemic or is just being used as it was originally designed to monitor it. If these data collections do not include one of the Washington Group data sets, then if they will not be able to be used for disaggregation, has been pointed out. However, if the questions are included, then any other information that is collected on those surveys can be disaggregated by disability status. And the same is true for any new targeted COVID-19 data collections. There are many that have been started up. These also should include at least one of the Washington Group's question sets so that data disaggregation can be conducted. That disaggregation gives you a lot of information. It's possible to look at the characteristics of persons with disabilities and compare them to those without. On your standard participation outcomes, these are your standard SDGs, employment, education, poverty, etc., as well as specific COVID-19 outcomes. And these might be indicators such as receipt of testing for COVID. You can also look at risk factors for poor COVID outcome, which might include underlying health conditions or behavioral risks. And perhaps extremely important in this situation is access to medical care and support systems. One can look at the characteristics of persons with disabilities and compare them to those without to see if there is unequal access. Now, disaggregation could be done for the standard disability definition that we use, or for specific types or combinations of disabilities that might be of particular importance in a situation, or for intersectionality of disability with other characteristics such as age, gender, or location. And many of the data collections done now are being repeated over time, so we can look at change. And if the disability indicators are included, you can compare the pre-pandemic period to the situation during the pandemic to see if challenges have increased or perhaps have decreased, and also to look at the monitor the effectiveness and inclusion of programs and policies that have been in place to respond to COVID. Now, while COVID-19 has increased the need for information, it has also affected some of the frequently employed data collection methods that we have relied on. Many data collections that have used in-person interviewing have been suspended or have transitioned to other data collection modes, particularly telephone interviewing or web-based interviewing. This minimizes the risk of exposure for both interviewers and respondents. And this may stop the decline in response rates if respondents are reluctant to communicate face-to-face with people outside their households during this crisis. And any decline in response will affect the quality of the data collected. And we particularly do not want to affect the quality, the inclusion of persons with disabilities in these data collections. Now, while the Washington Group tools had been thoroughly tested, they were not explicitly tested in telephone or web surveys. However, we have many reports of countries that have used the questions in telephone or web surveys, actually all of them, the short set, the extended set, and the child functioning module. And we have so far not received any reports of problems with doing so. But that said, there are some special considerations related to phone or internet survey administration. These apply to any survey done using these modalities, not just surveys that might be looking at a disability impact. And they relate to how persons with disabilities are fully included in that data collection. And one of the most important is sample bias, which is how well does the set of respondents that you have, how well does that set reflect the population you're interested in? So how well do they include persons with disabilities? Now, not everyone has a telephone or uses the web. This is a general problem with phone and web surveys. And we know that in some countries, people with disabilities have less access to telephone and the internet than others. And there is some evidence that this not only occurs at the household level, where there might not be any internet service in the household where the person with disability lives, but even within the household, there might be less access for persons with disabilities. There's also the question of stigma. We have a lot of evidence that in some data collections, persons with disabilities are not included in that data collection because of stigma. And it's believed that this is more likely to happen in phone or internet surveys where there is no interviewer in the household who is observing what is going on. There are also some challenges for people with hearing or communication difficulties when interviews are done over the phone. And again, if this population is not included in that data collection, there will be bias in the results. There are ways to address these challenges. Sign interpreters can be used. There are other assistive devices that may be required for effective communication. And when we're developing these data collections, this needs to be kept in mind. If none of these are possible, then proxy interviewing can be used. Sometimes interviewers feel uncomfortable when they ask questions that they believe they already know the answer to. This is true of whatever they're asking about. It applies to in-person interviews, but it's thought to be more of a problem on the phone, and is particularly if you're interviewing somebody with a hearing difficulty. But there are standard techniques that include informing a respondent that all questions need to be read exactly as written, and we need to train our interviewers so that they do that when conducting phone surveys. Internet administration may present a challenge for people with vision or cognitive or intellectual disabilities. And again, if these folks are not included, there will be bias in the results. As in the case with the phone interviews, procedures must be developed to create accessible web-based surveys, and we need to take advantage of the abilities of the technological abilities of internet surveys. Assistive devices are available. There are kind of a whole host of ways that one can meet these challenges. And again, proxies or interpreters are an option. But this has to be part of the planning process. And finally, I just want to say something about translation. The Washington Group developed a very explicit strategy for translating the questions into other languages. And this was done to assure cultural appropriateness, that the constructs were adequately captured, and so we could increase the reliability of the data. However, in certain circumstances, and such as humanitarian response and in a pandemic, timeliness is extremely important. And we may not have time to do the full-scale translation that is recommended. But there are some guidelines that should be followed. It's extremely important that translation by an interviewer at the time of the interview should not be done. And this is usually called translation on the fly. It should be possible for translations to be developed prior to data collection through a team effort, including interviewers and supervisors and members of the community, to make sure that the translation is appropriate. So just in sum, I'd like to say that tools are available to monitor how people with disabilities are affected by COVID-19 and will be affected by other of these kinds of incidents in the future. But if they are not used, it will not be possible to address any disparities in how we respond to these disasters. And particularly important where you have a population that is likely to be disproportionately adversely affected. It's important to plan now for future data collections to develop the mechanisms so that we will be in a place where we won't be catching up after the problem starts, and we'll have the data collections in place. And if we are going to rely more on phone and internet surveys in these kinds of situations, we also need to develop the appropriate ways of removing any kind of barriers to participation. So again, thank you very much. And it's been a pleasure for the Washington Group to be a part of this event.
Thank you, Jennifer. Thank you for giving these examples of how the states can collect more consistently information and how to integrate the work of the Washington Group into this work. Also looking at how these tools can also serve surveys and processes that are taking place at this moment. Yesterday, we participated in a meeting with the independent expert and other persons. She also raised the issue of the digital gap and digital literacy of this particular population, which is definitely largely disproportionately impacted by COVID-19. And we look forward to see further developments, particularly looking at the coming months and how we're going to address these issues. So thank you, Jennifer, very much. I would like to first encourage participants to post questions on the chat box. We've seen an array of different, very good entry points for you to engage, and we would like to start perhaps looking at some of the questions that you have posed, and maybe go back to the panelists for a couple of minutes. Maybe we can do it in the same order as presentations came. So perhaps I will start with you, Neda. So we have a very concrete question that is related to what are the next steps to bring policymakers, statisticians, and organizations of persons with disabilities together to make evidence-based policy addressing and improving the situation of persons with disabilities. And if there had been any particular work that was done in relation to COVID-19 in the region. So Neda, I give you 2 minutes for that.
Yes, with regard our next steps, we are actually going into gathering, applying the Washington Group on administrative records. So that means we will add more questions to the Washington Group, because then we will go into accessibility, other areas that are much needed by persons with disabilities, not only about the prevalence and their situation with regard to the education or work in comparison to people without disabilities. And we are, with regard to COVID, we are actually exploring now and we will be also working with the Washington Group into developing something related to the mobile data collection or other means of data collection. So we have 2 objectives for the time being. We are going to work with the Washington Group on. Thank you.
Thank you. Thank you very much for informing about those next steps that are looking beyond identification and disaggregation. Jose, we have 2 questions for you. The first one is related to if there's going to be any training or capacity building conducted around the toolkit. And the second one is related to what are the efforts that the different organizations that participated of the development of the tools are undertaking to disseminate the tools with governments and other agencies, as well as grassroots organizations. Jose, you have 2 minutes.
Thank you, Facundo. The toolkit, as I said in my earlier intervention, is the result of actually pretty much what you have described in the questions, Facundo. We have developed a number of webinars and trainings, and actually the stakeholder group of persons with disabilities in general, but particularly the working group on data collection, has been very active in trying to engage OPDs and statisticians around data collection. With regards to the toolkit, today is the first day that we have this toolkit available. So we are now hoping that a lot of people can use it. Many organizations can benefit from it. But at the same time, people and organizations can contribute to the toolkit. We believe that this is a long journey, a learning process. This is just one example of how OPDs can also play a key role. The toolkit even contains case studies where there are some good examples of how OPDs were involved in data collection, producing data, analyzing data, and even using the data that we collect. So I think the toolkit now is for everyone to use it. And from the stakeholder group of persons with disabilities, the International Disability Alliance, CBM Global, and other partners, we are sure that we will be shortly launching more opportunities for this toolkit to be used. And one very final comment, I think it's critical that statisticians, governments, OPDs at the national level, and even more in particular with regards to COVID-19 at the subnational level, this toolkit can be disseminated. This is our commitment, and we hope that we can find you in that journey towards inclusive data collection for everyone.
Thank you, Jose. Just one brief follow-up question. Can you share where is the tool available? Is the tool already published?
It is published. It's I think it will be we will be sharing the link to the toolkit through the chat box if we haven't done it. So, but if you go on the International Disability Alliance website, you could find it. But I'm sure one of my colleagues will post the link on the chat box.
Thank you, Jose. We will definitely help you with the dissemination of these tools, at least from our office. Miriam, we have one question for you that it's related to what age was a study survey conducted? So from what age, I'm sorry, was a study survey conducted? So, and also if you can share what was the methodology to conduct a study in Bangladesh. You have a couple of minutes.
Thank you. So actually the respondents, they were from all age groups, meaning children, younger people, under 18, adults, but also older people. And as far as methodology, we used the Washington Group short set, as well as the UNICEF child functioning module. And I think on the Washington Group, Jennifer is certainly the expert to answer questions on this one. And please be aware that we actually shared the report also in a chat box.
Thank you very much. Since we have a couple of seconds, I would also like to ask you another question, a follow-up question. Have you encountered any particular problems at the moment of implementing or raising or using the Washington Group short set questions in that particular context?
Yes, so the problems that we especially encountered were, of course, because due to COVID-19, the interviews, they had to be done by phone. And so that sometimes, for example, if you had a respondent who was deaf or deafblind, of course, you ask a proxy. And there, actually, it's very important if you have a proxy, you need to have enough time and you need to make sure that the question is answered by the person with a disability and not by the proxy. So these are, of course, challenges that we encountered due to the COVID situation. Yes.
Thank you. Definitely highlighted perhaps by the COVID situation, but not an uncommon situation for persons with disabilities to be replacing their voices, right? Thank you for that. Anderson, we have a question for you with regard to how, if in Kenya we have seen a decrease in the prevalence rate of persons with disabilities in successive surveys, and what could be the issue and whether this has been discussed with the National Statistical Office. Can you please tell us how this was addressed?
Yeah, thank you very much again. Yeah, it is true that after using the Washington Group questions in our last census, that the preference has gone down to 2.2. Previous surveys had it at 3.7 or thereabout. And this has brought a lot of contention. The issue has become very, very contentious, especially among us key stakeholders who are involved in work of disability. And these are issues that we've also picked with authorities, with the Kenya National Bureau of Statistics and other government departments. And what we have agreed collectively is that we're also going to conduct a survey to be able to ascertain the figures that the preference that was reported. There is also further work that is ongoing in terms of analysis, what we're calling the monograph, which will be a detailed a presentation of the various characteristics. And because quite a number of issues could have led to this kind of a result in terms of, for example, translations, because these questions, when asked in our various vernacular languages, they may have a distorted meaning. There is also a lot of stigma associated with the disability in our community, and there is a way you can frame a question and then people run away or are not keen on answering that kind of a question. So we are hoping that further analysis of the available data, including the survey that is planned, will be able to answer quite a number of these questions. Thank you.
Thank you, Anderson. Thank you. And I very much reflecting on what Jennifer said, right? On the cultural, let's say, domestication of these questions and how to approach it in a way that it's most effective. I will keep you on the line, so if you can come back to us. We have another question that is related to how difficult it was or easy it was to get the buy-in from the National Statistics Office in Kenya to include the Washington Group in the census, and if there were any particular challenges and how you managed to move them forward.
I would say that in Kenya, sorry, we were lucky that our Statistics Commission, the Kenya National Bureau of Statistics, have been very, very responsive in terms of listening to the views of persons with disabilities. This is so because Kenya has also ratified the Convention on the Rights of Persons with Disabilities, and we have our laws, especially our Constitution, has also heavily borrowed from the Convention on the Rights of Persons with Disabilities, and that convention, as well as our Constitution, is strong on the need for government to involve citizens as they make certain decisions. So it is a requirement that, for example, when the Kenya National Bureau of Statistics or other government agencies are designing programs, are designing policies or projects, they have to involve people who will be affected by whatever intervention that they are coming up with. So we had quite some good working relationship with our commission, and even now in terms of especially them involving organizations of persons with disabilities as well as other stakeholders who are involved in providing services to persons with disabilities. And as I said, This is a direct result of a lot of capacity building for both leadership of organizations of persons with disabilities, as well as also building capacities of officers from the Kenya National Bureau of Statistics. And the Washington Group Secretariat has been out to support us in some of these capacity building processes. Thank you.
Thank you, Anderson. Very, very clear, and thank you for sharing that experience. And I'm happy to hear that the Bureau had been extremely supportive of including the questions in the census. Thank you very much. I will move that now to Jennifer. We have a question that says, in the Washington Group short set of questions, that is in connection with the Washington Group short set of questions and the 4 responses. So I imagine that it's for the 4 levels. Would the quality of the data or the response be compromised when a 5th answer is introduced as "I don't know"?
So two ways of thinking about that. As I mentioned that the questions were designed originally to be incorporated into ongoing data collections, and each data collection agency, particularly national statistical offices, kind of have their own way of organizing a questionnaire and doing training on that and kind of implementing that data collection. And there's kind of 2 schools of thought in the statistical community. One is that if you offer people a don't know response, they will take it because it's easier to say don't know than actually think about the answer to the question. And this applies to any question. This is not about the Washington Group disability questions, it's any question. So you tend to have much higher levels of don't know when you offer it as a response. But other people believe that no, that's a valid response and you should offer it. In most cases, for an in-person or a telephone interview, they are not offered. You don't offer a don't know response or a refusal. But if somebody says don't know or says I don't want to answer it, there's a place on the questionnaire where you write that down. Internet surveys are a little bit different, or any kind of survey that is a self-response, a paper and pencil that you might get in the mail or fill out in an office or something like that. Those tend to have a don't know response because if people really don't know, they have to have something to check. And on an internet survey, the computer program is set up so that if you say don't know to one question, it'll send you to the next question. So it is really more of a function of how the questionnaire is implemented than about the question. So the standard set that we put out does not offer the don't know as a response, but we understand that in some situations, a data collection agent, whoever that might be, might incorporate a don't know for logistic purposes or because they do that for all of their surveys. And you also have to remember if you're doing this on the phone or in person and you have to say don't know after every question, it just increases the length of the survey. And when you do that, your entire data collection quality goes down. So you don't want to have words that you really don't need in being asked in person or phone, whereas you might on the internet.
Thank you, Jennifer. Thank you for clarifying that. Was a very technical question. It's good to hear that we have colleagues participating that are interested on looking at the nitty-gritty of these particular aspects. We have a couple of statements that are related to the legal attention that was given to COVID-19 and persons with disabilities, and how there is a big data impact that is also resulting from that legal attention, and how the recent webinar from the World Bank highlighted many of the difficult challenges that are ahead. We have some more minutes, so we continue to encourage colleagues to pose some questions. So I think we have a great question that would give the floor for you to look at what you have already presented and what are the issues. So if you can perhaps in less than a minute or so, there is a question that is coming to all of you. If there is, in your experience, if you were to change one thing on disability data with regards to the global community, would it be? So perhaps we can take a quick round, starting with Neda, afterwards Jose, Miriam, Anderson, and engage very briefly on this question. So one thing that you think that needs to change, and we'll move from there.
I would make it, I would say, I would make it more accessible and more comprehensible to the researchers or policymakers or any stakeholder that may not be able to understand the data. The more we make it more understandable, then it will be better used and reached and put into more of useful. Producing data is not enough. Using it is what we want to happen. And this is on the side not only of the policymakers, but it's a responsibility on the statisticians to be more proactive to make it reachable to the people. Thank you.
Sorry, I was saying, thank you, Neda. So improving access and accessibility and clarity, right? So that would be key. Jose, what's your point on this one?
Thank you, Facundo. You asked for one, but unfortunately, I have more than one, or fortunately, I don't know. The first thing is I echo my colleague, accessibility. The more accessible the tools are for data collection, the training available, the more people with disabilities will get involved. My second thing is to continue promoting this type of learning and changing spaces. We need to get more people in the room from disability organizations, from statistic office, governments, etc., to continue this discussion. And third, we really need to understand the different roles that organizations of people with disabilities, governments, etc., can play around the data collection for people with disabilities. The more we define how we can contribute to the discussion, the more we can clarify what is the responsibilities, the roles, and the technical contributions that we can make, the more inclusive and accessible data system for people with disabilities we will have. Thank you.
Thank you, Jose. Thank you for bringing those aspects. I will take participation as the big key of your presentation. Miriam, one thing.
Yes, thank you, Facundo. So as I've been saying, I think community-driven data is really important, and it has to be considered because you're still leaving persons of disabilities behind. And so one thing is actually we need to collect, we need to analyze data, but then actually it has to be implemented to actually close the gaps that are still persistent.
Thank you, Miriam. Definitely collecting data to leave it on the shelf makes no contribution. So Anderson, what would be the one thing that we need to change?
To me, I think I will have two things. Number one is what I would want to emphasize is the need for strong collaboration between the various government agencies involved in generating and in using data, as well as other non-state stakeholders. And of course, close consultations with organizations of persons with disabilities in the processes of ensuring that we have community-driven data to inform policy and programs. The number two is all about sustainability. For example, in our Kenyan situation, we have formalized structures to ensure the meaningful involvement of organizations or persons with disabilities for purposes of sustainability. We have anchored these structures in a government system. This is where we have, for example, the technical working group. We have also collectively agreed on the approach of ensuring that disability statistics is not only given prominence in national censuses and surveys, but also extended to administrative data that is regularly collected by the various government agencies and other partners as they provide services. And this kind of data can be utilized in planning, monitoring, and evaluation of programs and projects, and to ascertain a compliance to Convention on the Rights of Persons with Disabilities, as well as SDGs. Thank you very much.
Thank you, Anderson. Thank you very much. Jennifer, your 1 point.
1 point, but it's a big one. When the Washington Group started, one of our kind of objectives, what we talked about internally, was we were interested in mainstreaming disability data. And for us from national statistical offices, it meant that including information on disability became part of all the ongoing data collection, similar to what Anderson just mentioned, that it wasn't added kind of every 5 years or when there was a donor. But it actually is something more important than that. Disability statistics should be addressed and considered in the same framework as any other kind of statistical objective. There are many people in statistics who spend a lot of time and effort working on perfecting and building economic statistics. They don't kind of do it once and then say that's what we're going to do. And there's a huge amount of error in all of the statistics that we all rely on and have come to understand. And we want to get to a point where disability statistics are in the same kind of framework where we have a good base, but we're always improving on it. We're always looking to how we can make it better, and that we learn to understand some of the errors that are inherent and don't let that stop us from appropriately using the data. And I give a lot of credit to our colleagues in Kenya for taking the data they've collected, looking at it, evaluating it, building on it, understanding what might be missed, but what they can get out of it. And that is a very standard way that other more developed parts of statistics have used. And that's where I would like to see disability statistics going as kind of part of this fundamental structure that is in this constant improving situation with all of the inputs that have been mentioned today.
Thank you, Jennifer. Thank you very much. Definitely, this is a call that is coming also from the Convention on the Rights of Persons with Disabilities, that we make the use of data as an integral part of the work of states and governments to inform policy, to improve the way forward, and where that data is not being collected at census level or surveys level, that we can count with the work of researchers, of organizations of persons with disabilities, so we can start hinting where are the gaps, what are the things that we need to address, and what are the problems ahead of us. I think all of the examples that all of you have given today are extremely useful, particularly at this point, looking at 5 years of the adoption of the SDGs, in a moment where we are also in the middle of a health crisis that is progressing into a socioeconomic crisis that will take us many years to recover from. And we need to be paying attention to how data collection and data analysis will guide policymakers on how to move forward. Coming to the last minute, I would just like to thank the panelists, would like to thank the interpreters, the captioners for the work that they have done. I feel that this meeting has been extremely useful. Follow-up questions can be sent to hlpf2020@ida/secretariat.org. You have that also in the chat box, that email. I very much encourage you to engage with colleagues with International Disability Alliance and with IDDC to move forward. From OHR, we are delighted to be part of this event. We also want to invite you to come to us and to continue collaborating and moving forward. Thank you very much and have a great day.